What is retrograde ejaculation in male infertility? Imagine trying to get pregnant and finding out that your semen isn't coming out the way you expect. One possible reason is a condition called retrograde ejaculation. In this condition, instead of semen being expelled through the tip of the penis during orgasm, it flows backward into the bladder. This happens because the muscles at the base of the bladder, which normally close tightly during ejaculation to direct semen outward, don't work properly. As a result, sperm don't reach the outside of the body, which makes natural conception very difficult. Retrograde ejaculation is considered a type of ejaculatory dysfunction. It accounts for a small but important part of male infertility cases. The main concern for fertility is that sperm are not present in the semen that is ejaculated, or they are in very low numbers because they have entered the bladder instead of exiting the body. Even if a man produces healthy sperm, this backward flow prevents those sperm from reaching the egg naturally. Common signs of retrograde ejaculation include little or no semen being released during orgasm, sometimes called a dry orgasm. After orgasm, the urine may appear cloudy because it contains semen and sperm. To diagnose the condition, doctors usually analyze a urine sample collected shortly after ejaculation. If the sample shows a high concentration of sperm, it indicates retrograde ejaculation. There are many causes behind this condition. Nerve damage from diseases like diabetes or multiple sclerosis can interfere with the signals needed for proper muscle function. Certain medications, especially those used for prostate enlargement, high blood pressure, or mental health issues, can also cause retrograde ejaculation as a side effect. Surgery involving the prostate, bladder, or pelvic area may damage nerves or muscles, leading to this problem. Sometimes, stopping the medication or treating the underlying condition can reverse retrograde ejaculation, but in other cases, especially with nerve damage or surgical changes, it may be permanent. Importantly, retrograde ejaculation does not affect a man's ability to enjoy sex or have an orgasm. The issue is with sperm delivery, which is essential for natural conception. If a couple is trying to conceive and retrograde ejaculation is identified as the cause, there are medical options to help. Doctors might prescribe medications that help the muscles at the bladder neck close properly during ejaculation. Alternatively, sperm can be retrieved directly from the urine after ejaculation for use in assisted reproductive procedures like in vitro fertilization. It's also good to know that retrograde ejaculation is not harmful to overall health. However, it can cause emotional stress for couples struggling with infertility. Treatment options are usually focused on helping achieve pregnancy. If you or your partner experience symptoms like dry orgasms or difficulty conceiving, it's important to consult a healthcare professional. They can perform tests, diagnose the cause, and recommend the best course of action. While endometriosis mainly affects female reproductive health, it's part of a broader fertility evaluation that includes both partners. If retrograde ejaculation is diagnosed, fertility specialists can guide couples through options like sperm retrieval and assisted reproductive technology. With proper medical care, many men with this condition can still become fathers. Remember, each person's situation is unique, so personalized advice from a healthcare provider is always the best step.